Hi everybody. See, I was in New York. I was having a chat with my friend there. He is also same dental practitioner like mine. So he stays in outskirts of New York. Dr. John Christopher. He's about cause he has got a practice of close to about 2.5 decades to 3 decades of experience, same like mine. So on a coffee we were chatting about how things are going in the industry. So he was telling about it. There's a workload which is going on more of the patients, and in the US the system of dental appointments is totally different than in India or other countries. So he was talking about that in an average he is a solo OPD and they've got 2 dental chairs which are being there available. So he was seeing at most about 12 to 15 patients in a day, but he cannot increase the load because lot of manual intervention of the patient explanation has to be done. So on a casual thing, he told that here we follow a lot of insurance adaptations of the policies, wherein I get most of the there is something called as a PPO, which comes down private insurance provider, as well as from the Mediaid, which is a government funded body. So I get a lot of from my patients from APO, but I am unable to handle more number of patients because of time constraint. Usually they work for 5 days only in a week there. So that was a concern, and if you can just now after the innovation of AI from past 2 years, something all in the AI file buzz is going on, can you look into it and can you give me some insights or provide solutions? So I thought this is an opportunity, let me look onto it. So when I saw that he sees 11 patients per day and average consultation for an explanation, traditionally any part of the globe, how much of technology is also there, physical intervention with the patient is there, because in dental it will be a many number of settings we need to go about it to the patient. First you need to explain with the x-ray, show him the scenario. He just mindly in the mind that this is happening in the mouth. So if some animated videos also are shown in the real time also, okay, this is a procedure, and lot much of time goes in explaining the patient till we get the first appointment. So then an average time which we calculated was about roughly about 20 minutes he spends on a consultation, rather followed by the thing. This is a hair on fire problem which we see usually in US. What happens is, first as the patient walks in, and most of the 90% operatives have got an inbuilt in-house OPG as well as RVGs as well as the intraoral scanning machines. It's not like India. So they have to do a preliminary scan, photos, everything gets uploaded onto their ERP system and comes on. But physical explanation takes drains of the dentist, and we have to get the trust to the patient. Most of the times what happens is the patient thinks emotionally, they may not psychological, not even many people, folks you may know, they are very much worried about sitting down in a dental chair and getting a treatment done due to the fear, anxiety, so many other factors are there, which makes the patient little more uncomfortable. And on the top of this is the pricing part of it. They think, okay, dentists are going to give them a big bill and he's going to upsell certain products for that. So in order to that, the dentist takes a lot of time in explaining a lot treatment procedures in detail, such that the patient gets the inference what treatment he is getting into it. So this is the pain problem which I am trying to solve on the behalf of my fraternity. So usually by getting technology into place and giving a solution wherein we will be able to help dentists achieve more number of patients, and they get a result on a volume base for solution for people. Usually there are one second. Function 11. Usually there are dentist usually takes photographs as well as OPGs which goes onto their system, but we are created a software as a product wherein it's a tool, I will call it, of using all the database, and it has been it can be assembled in any part of the it's a system. It can be get into all type of ERPs. So it gives an instant solution to the patient there, stating that this on patient's photographs are there, patient's x-rays are there. On to the same thing, the software provides you instant solution, and it hardly takes 1 minute or 30 seconds to give the inferences. It is just a tool. It is not a diagnosis, but it will be, the algorithm is being made by, it is being devised by doctors and a team of doctors, and train the model, and the inferences have been levied onto it. And finally, the foresight will be with the dentist who is treating the patient. It gives you a provisional diagnosis type of a thing. The patient understands the procedure. It will be patient's own teeth, patient's own X-ray, and in visualization within 30 seconds to 1 minute they can give it. And it has been linked to their insurance providers at the US there, and it automated how much is the treatment cost in the same report they get it. One. Second part of it is that certain in US there are two type of Medicaid is a government insurance, and the private providers, whenever they choose a lot many people, whatever depending upon their premium, it is about 180% or 50% which has been on the coverage things. The system gives you an auto inference of the insurance has been allocated to them or not. So within a minute or two the dentist gets the report instantly till the patient walks into the operatory, because the chief complaint is already registered in the why the patient has come down. So based on the X-rays it is there. Then the doctor examines. It is a tool for him to give the inferences, and patient also acceptability is more, that they see something is happening to that the treatment which they foresee. The dentist can also foresee, even the patient also can foresee that. Usually according to the survey we have taken done about, there are 4 lakh clinics which have been, there is a SAM model which has been available. So total average TAM is about 3.68 mil, but clinic which has got SAM with along with OPG equipped clinic is giving a revenue about 720 mil. So if initially we target for a SOM for 2 year target for about 4% of the clinics, we will roughly get about $28.8 million as a revenue for that. The value proposition pitch is about on the CAG we spend about so the dentist here the thing is, without the AI interference the doctor sees about 11 patients per day, and the case acceptance rate is about 45%, and a daily billing value is about $1,500. But using the tool, he sees about 31 patients per day, and AI acceptance rate is about 85%, and diagnostic billing comes to about $8,000. It is roughly about 5x the cost of the revenue he generates it. So by here we are solving both the dentist problem where his revenue also can be, and even the main important thing is the time leverage, because in 24 hours and even in US only 20 to 22 days they work, and 5 days in a week only they operate, and they have got many holidays. So patient workload is more and patient waiting period is more. So we cannot give many appointments because the time is being constrained.
Time is up.
Okay. Phase 1 will be pilot validations for about 1 to 3 months with 5 active clinics which already I have reached to them. So they are agreed after the pilot comes on, we can just go to the market in 4 to 8 months. Utility Technomics is the $12 per month will be the CAG we take it up, and 350 clinics we take, then the run rate will be about 28.8 mils there. The investors exit as well as the second stage or the final stage when we want to exit, the company valuation will be about $432 million, and it can be acquired by companies like Overjet AI, who are the pioneers in X-ray detection. Only they are focusing on PI views X-rays, the RVG X-rays views. So they are giving a subscription about 500 rupees per month and everything. So I am quoting for the $150 per month as a subscription charge for a solo practice. The business model can be scaled up or tweeted according to the need of the things. Thank you. If any questions are there, please let me know.
So, doctor, what is the primary pain point you are solving?
Time of the dentist. He is not able to, in 8 hours, there is not much of a time appointment. So 20 minutes already goes on to the
and
consultation.
by each patient looking at the video and understanding that 20 minutes will be reduced to,
hardly 2 minutes.
but you still think patients will be convinced to get the service done from the dentist in that 2 minutes?
It might be 50% of the patients may agree with it, because the technology is transforming so many things. It will may take
Correct, but
time.
the human touch and discussion, that's where it makes a lot of difference.
No,
right?
human touch is all it will be there. It is just an auxiliary tool in a dental office. How intraoral scanners are there, previous primary impressions they used to take it and do things. Now this is all with the camera thing, and instantly on chair within 1 hour we can mill a crown and do it off. So it is a technology in progress, work in progress, like.
And but it needs to, your tool needs to speak to a lot of existing software, insurance.
Yeah.
So
This is it can connect to any tool things. It doesn't require the turnaround time is 0% according to the.
so how does that work? How does it pull data from another ERP? Could be any ERP.
So,
that operates
yeah,
in, and then the insurance also you said, right?
Yeah, insurance also
so
about
how
it.
does it work right now?
Right now it is got. I'll give you an example. One of my friend Ritesh, he is in Austin, Texas. He is using agentic AI for the calls and all. So they have been given approval to all ERPs to be done. The same code we are going to deploy it and use it.
So then what is the current state of the product? Who is building it?
I have not introduced myself. Myself is a subject expert in the clinical thing. I've got a CTO who is building the product. He's a tech guy from Etisalat, Dubai. Healthcare product. Only 2 persons are there as founders.
But then who will go sell in US?
So after we raise a pre-seed
But that's your primary.
primarily, yeah. We will have to onboard some co-founder who is into marketing or sales.
But
or,
you need money to do that.
Yeah, do that. Presently, we have bootstrapped it, and we have created even the X-ray interpretation, which has been known for an OPG as well as the photographic thing. So we have roughly spent.
But you don't have any money to start working with 5-10 customers.
No, 5-10 customers. Pilot we have already given them, but it requires local GPUs to be installed with them to get the traction done. So that is how, because the clients are in US, we need to remotely show them this is how it works and all. But they have done a trial and testing, and even I have given the product to my Singapore dentist as well as one dentist from Riyadh. They are also using, just giving the feedback, because I should be knowing, because as a dentist I am, I think, only from one perspective of it.
So that
they
is
might
fine.
be.
The problem is while you are built, and comparatively today software building, people don't consider rocket science, right? It is more from the point of what traction you have. And then if you need fund to even do your BD and sales, is where it will be difficult. You understand, right?
Yeah, I got it.
From the point of, people will always look up to you saying that, okay, you have so much of experience, I'm sure your co-founder will also have. What stops you from hiring someone who does sales there and then see if something is working out? Because right now, one is the product, the two is the traction of using the product, and then is it actually saving the time for the dentist?
According to the freebies, they have.
So that's, but then when I use it 1 to 5 times, it's okay, but when I need to use it for 30 patients on daily basis, then how the workflow works, how the patient is taking, what they are not able to understand from video, and then still my 2 minutes is becoming 5-10 minutes. All that is where it will make a difference to understand, right, whether it's working or not.
Initial runway we have created. No, we are just because so only I've joined 18 startups, so I do not know. This is a journey. I'm open to all suggestions and advices.
To understand that building software is not going to cut it.
Yeah.
There has to be something that it has already been on the ground, used by so many people. That traction is where it is important.
Any suggestion how I need to re-pivot myself?
No, there's no pivot point of view. It is just from the point that if you are building something, someone needs to use it, and then if they can pay for it, and then how more can pay for use it.
So one more thing, which experiment for an Indian audience I did was I registered for 4 doctors of my this part of it to use and show locally, which has been.
You need to understand how much you are going to charge and how much Indian doctors would pay.
Indian doctors, the prices haggle, so only my market is totally based out of.
So then someone needs to be there to sell in the market.
Why you want the Indian doctors pay? if it provides them value, why won't they pay?
No.
He knows
See,
why you
why, hardly for 5,000 rupees of subscription to a to anything, any ERP, we do not have the mindset of adapting it here easily. We may build a product and sell it in the US, but we do not want to use it ourselves, pay that part of the money. The same thing, there is no 1001 ERP for the voice agentic AI. The subscription is my product. I've just quoted 150 because it's to rule. He is charging about 1,000 rupees subscription. He has just acquired only 40 clinics, and different states of in the US, different state, different jurisdictions. All those things are there. So the dynamics works. So
Okay.
okay, sir. Thank you, sir. Thank you very much.